The authors also referred to a World Health Organization report that said there is no reliable evidence that infrasounds below the hearing threshold produce physiological or psychological effects. The British report continued that the common cause of complaint was not so much associated with low-frequency noise, but with the occasional audible modulation of the aerodynamic noise, the so-called swish-swish sound we've talked about earlier. The authors also indicated that of the 126 wind farms operating in the UK, 5 reported low-frequency noise problems, and they concluded that such complaints were the exception rather than a general problem for wind turbines. There's also been a study just reported about 2 weeks ago at a conference in Baltimore where 15 wind turbines were evaluated in the vicinity in an area of Texas. And again, these are the results, conclusions of the authors, that they found that the infrasound was inaudible to even the most sensitive people, 305 meters, which is about 1,000 feet from the wind turbines. They also concluded that low-frequency sound above 40 hertz may be audible, of course, depending on the background sound levels. They also concluded that at maximum noise at a distance more than 305 meters from the nearest resident, the wind turbines do not pose a low-frequency noise or infrasound problem. And they compared their results to ANSI, which is the American National Standard Institute, which sets guidelines for a lot of occupational and environmental exposure matters in work and in the environment. They concluded at this distance the wind farms met the ANSI ASA indoor levels for low-frequency sound for bedrooms, classrooms, and hospitals based on background sound levels. Now, low-frequency noise and health effects. I've talked a lot about annoyance with respect to living in the vicinity of wind turbines. There have been some efforts at looking at health issues as well. A Dutch investigator actually evaluated Vandenberg, looked at health-related effects of living in the vicinity of wind turbines and corresponding exposure to low-frequency sound. And he concluded that there was no link between the noise levels and either risk of diabetes, hypertension, tinnitus, which is ringing in your ears, and cardiovascular disease. And to the contrary, they found that the illnesses were actually more common at the lower sound levels than at the higher sound levels. This is an important principle in occupational and environmental medicine, and that's what's called the dose-response relationship. Everybody knows if you smoke a pack a day of cigarettes for 20 or 30 years that you markedly increase your risk of lung cancer. Similarly, if you drink a 6-pack a day for 15, 20, 30 years, you're markedly increasing your risk of liver disease. In contrast, people also know that if you smoke 1 cigarette, it's certainly not as good as never smoking at all, but it's not going to substantially increase your risk of lung cancer. So a dose response is very important to consider when evaluating any potential health implications. Are there other perspectives we can look to get some guidance on infrasound and low-frequency sound? Actually, there's been a lot of work on low-frequency sound and infrasound that goes back into the 60s and 70s that has actually very helpful information, I think, to inform good policy decisions here. In fact, in the Apollo space program experiment, subjects were exposed to between 120 and 140 decibels of low-frequency noise without harmful effects. 140 decibels, by contrast, remember that's like standing next to a jet engine. 120 decibels would be probably putting a power saw right next to your ear. And the U.S. space program studies indicate that 24-hour exposures to about 120 to 130 decibels are tolerable, below 20 hertz, the upper limit of infrasound. And modern wind turbines produce sound that is assessed as infrasound at typical levels between 50 and 70 decibels below the hearing threshold of those frequencies. This is a report done by another Scandinavian author, Jacobson, who also concluded that infrasound from wind turbines does not present a health problem. There's another perspective you can look at to try to get an idea of the mechanism. Remember, we wanted to look at studies of people in the vicinity of wind turbines, and then when there's limited information, as there is with these 3 major epidemiology studies, then it makes sense to look at maybe mechanisms, look at infrasound, look at low-frequency sound. You should know that your heart tones are low-frequency sound. You should know the boiler in your air conditioner in your house is low-frequency sound. The dishwasher is low-frequency sound. Heart tones are about 1 to 2 hertz, which is, of course, infrasound. Lung sounds are about 5 to 35 decibels at about 150 to 600 hertz. These, again, are low-frequency sound. Now, a few meters from the device, windmill noise in the infrasound range rapidly becomes inaudible. It can be measured, and I'm told, I'm certainly not an expert in wind turbines, but I have been told that earlier wind turbines had much more of a problem with infrasound and low-frequency sound than some of the more modern ones. I don't have data to show, but that's what I've been told. Apparently, according to these authors, this is the French Academy, National Academy of Medicine, that the infrasound has no effect on human health. Fears regarding windmill-induced infrasound are thus groundless. Infrasound production by windmills has been well studied, and the levels are without risk to humans. This is an opinion of the French National Academy of Medicine in 2006. Low-frequency sound. Research with low-frequency sound has shown that inaudible low-frequency sound does not normally become objectionable, as it were, until it's about 10 to 15 decibels above the hearing threshold. And there are scientific studies that support this result. Wind turbine syndrome is something that's been introduced in the context of living next to or living in the proximity of wind turbines. What exactly is wind turbine syndrome? Well, I wasn't able to find wind turbine syndrome in the peer-reviewed literature, but there is a publication of wind turbine syndrome by an author named Nina Pierpont. And I've looked at the wind turbine syndrome by Dr. Pierpont to try to get an idea of what the hypothesis is that she has introduced that might address potential health implications of living in the proximity of wind turbines. And it looks as though, from what I've been able to gather, that the hypothesis is that low-frequency sound induces a corresponding vibration that may adversely affect human health. Remember, at the beginning of the presentation, I put up the slide there that showed as you get lower and lower in frequency, 20, 16, 10, and so forth, that the vibration level tends to increase. As I said, as of about May 2nd, I wasn't able to see anything published on wind turbine syndrome when I went to PubMed. Many of you may know PubMed. PubMed is a search engine of the National Library of Medicine that all taxpayers support. And if you enter in a key term, it's very much like Google. If you enter in a term at Google, Google will give you a search. Well, what PubMed will do, if you introduce a topic, will give you peer-reviewed papers that address the subject that you're interested in learning about. I wasn't able to find anything, at least published as of a few days ago. And as far as I'm aware, this is not a recognized diagnosis in the medical community. And there doesn't appear to be any unique symptoms or combination thereof that would lead to a specific disease. But the symptoms do seem to be real. There's no question about it that people living in the proximity of wind turbines report a lot of these symptoms. But it doesn't appear to be any new phenomenon as much as it's really a reaction, annoyance reaction to sound as opposed to anything new. The sound levels from outside the body, however, do not cause a high enough excitation rate within the body to exceed the internal body sounds. What has been done, there have been studies to look at what kind of attenuation the body actually provides to any type of sound. For example, there have been studies of women in their pregnancy who live in high noisy areas like near airports and truck terminals and so forth to make sure that high noise levels doesn't damage the developing baby. And surprisingly enough, it shouldn't surprise us in light of how well nature works, there's about a 30 decibel attenuation of the uterus, which means that if the noise outside the body is about 70 decibels, then within the uterus the noise level will be approximately 40 decibels. So the similarity between noise annoyance and those of wind turbine syndrome indicates, at least to our group, that the diagnosis is not a pathological effect, but most likely an example of the stress effects of exposure to noise, virtually any type of noise. And as I said, this syndrome, as introduced in the book, appears to be based on two hypotheses. That is that low levels of airborne infrasound from wind turbines at low frequencies directly affect the vestibular system. The vestibular system is that part of the body that affects our balance. For example, when you put your head into the sink to wash your face, it's the vestibular system that prevents you from falling into the sink. Similarly, when you close your eyes and you're washing your hair in the shower, it's the vestibular system that helps make sure that you don't fall. So the low levels of airborne infrasound from the wind turbines have been proposed to directly affect the vestibular system. And the other proposal is that these low levels of infrasound from wind turbines enter the lungs via the mouth and then vibrate the diaphragm, which transmits the vibration to the viscera. Viscera are the internal organs like the intestines, liver, and so forth. There's also another ailment, if you will, that's been introduced as potentially a consequence of living in the vicinity of wind turbines. Unfortunately, for most of these proposals, the information is really limited to what's called a case series. A case series, and I have written up published case series myself and case reports because they can have potential value, but I think it's important to recognize that case series and case reports are really not used by any governmental or non-governmental agency to draw causal connections between any exposure and any particular disease. Case series are interesting observations that may call for additional work, but in and of themselves, they're just not used anywhere, as far as I'm aware, for drawing causal inferences between any exposure and any particular illness. I was also kind of surprised because I did another review of PubMed under the search vibroacoustic disease, and there were about 36 references as of a few days ago, and for some reason I don't understand, but all but 2 of these were from the same Portuguese group noted earlier. and it's unclear why the rest of the academic world does not appear to have addressed this vibroacoustic concept introduced.